So regardless of what the environment looks like, regardless of what the limited formulary looks like, there is a duty to serve. And it doesn't matter what profession you are, we all come together.
All right. Hi, Dr. Garcia. Can you tell me a little bit about yourself and how you got into the field of global health?
Yes. As you introduced, my name is Dr. Angela Garcia. I got involved in global health initiatives first as a student. I attended as one of my APPE electives a medical mission outreach, and we used the full time of our APPEs to create research projects, get those cleared through the Ministry of Health, our own IRBs, created posters, and so there was a scholarly component of that. Once I had graduated, the organization that I traveled with asked me to come back and be the lead pharmacist moving forward. So I think that was really an opportunity. They had not had a pharmacist part of their organization team. They would always get volunteers to come, but to have a core part of developing that, moving forward in advance, I think was a big piece. And so I have coordinated multiple medical missions and set up the APPE experience for other colleges of pharmacy, presenting that to their boards and to their deans and departments to get that something that's been adopted. So that's really kind of been how I got involved in that, and then have progressed my efforts since then.
Awesome. Thank you for sharing. So why is global health important?
I think because as we begin to have more and more patients from different backgrounds, and as we start to see changes in our own healthcare system, it's important to give the students an appreciation to what's different than what they know and what they're exposed to. Most of our students are not international students, some of them are. And so they have one context of accessing care. And so when you're working with patients, many of your patients come from a different health system. They come from a different level of care and access. And so that I have found helps to give them a broader perspective of why they're seeing certain health beliefs and health behaviors in their patients, as well as being able to contribute to population health opportunities, and to see that, when you go in to do mission work, the idea is not that you come in and you do it for them, but that you come in and you leave a legacy of self-care. So you build up and create something that's sustainable in your absence, because otherwise you're creating a sense of dependence. And so I think it was really important for me with the work that I was going to be doing. The organization helps to engage different professionals to help maintain in our absence. And so I have been invited to teach at different universities in the country that I did mission work with, provide lectures, and help to kind of build up those resources. And so we make sure that there is a sustainable component and not a dependent component.
Thank you. And my final question today is, what kind of global health efforts were you engaged with before the pandemic started?
So I was the coordinator for an interprofessional medical team, and I still am in that role as a consultant to the university. And so we have two teams. One goes in June and one goes in December. And so we manage inventory. We do a component of education to teach the students and the providers, the attendings, what is the actual guidelines for the treatment in the country that we're in, as well as what we have as a resource for the guidelines in our country, because that helps when they are trying to prescribe, and it helps them understand what we've got in our inventory. We do a lot of kind of teaching indirectly, because providers assume, right, when they go there, that they can practice medicine like they do in the US, and they don't understand some drugs are not available. They don't understand what socialized medicine is. So teaching them to work with a very restricted formulary and to be creative in how we approach care has been a very giving experience on our end from pharmacy, but it lets the other providers see us really as ambassadors of problem solving, and working with what we've got to optimize the kind of care that we can provide. We give CMEs. With my drug information residency training, getting information not only to the provider team, but to the patients that we serve has always been very important. And so we try to include a cultural competence component of that. We provide the CMEs to the providers. We use resources while we're there that gives a very easily accessible comparison of the guidelines for that country as well as the guidelines for ours and where those deviations are. So that kind of helps to get them to understand what they're going to see in the patients that are coming to them. And I think most importantly is just the humanistic component of seeing something so very different and kind of in that snap minute having to shift into work mode. So regardless of what the environment looks like, regardless of what the limited formulary looks like, there is a duty to serve. And it doesn't matter what profession you are, we all come together for that purpose. And at the end of the day, being tired, exhausted, and hot, the gratitude that's shown by the patients really helps you justify the sacrifices that you have to make financially and otherwise to be a part of something so powerful. And I think what it does is it also gives encouragement for people in other countries to say, I can work to help my community and they don't have to be providers. So creating sustainability opportunity, I think, is the thing that's the most important for me when we leave.
Awesome. Well, thank you so much for sharing about your experiences today. Have a good one.
Thank you.